All right, do you see the indicator that we're recording? Wonderful, good. All right, I was calling names. So we were at, is it Cha or Chow? Just let me know if I'm mispronouncing your name, please, or give me a pronunciation key in the chat. We have Cheng. We have, oh, this is not working. 1 minute. Okay, and then Christina, hello. And Dola, tell me your other name if I'm not mistaken. I think you go by another name. Just let me know, remind me. But welcome. Evelyn, welcome. Fiza, Hina, I believe it is. Oh, I'm so terrible with names. I don't know why I do this to you every semester. Jahinson, Katya, and Kayla, hey. And Keisha, welcome. Okay, so a few of you are new to me. I don't want to mess up your names. Lachena, Natan, Patricia, Sheridan, yep. Simran, hello. Tosin, Uba, Vicky, Victoria, and Victoria. And our friend Venus. Welcome, welcome. So I apologize in advance for mutilating your name. Please forgive me. But what we will do is have you please, for this week's assignment, post something in the discussion board that I'm going to create. Just introduce yourself, tell me your name, if you have another name you prefer to go by, how to pronounce your name if it's a little tricky. Why is not a name? Why can I get a name? And also your preferred pronouns, because remember, I can't see your faces. So tell me if you prefer she, her, or he, him, or they, them, right? And I would do my best to use the name that your mother and your father gave you. How's that? Yes, I find it quite hard to hear you. My volume is on full and it's very quiet. Okay, so I just thought about it today. I'm probably going to invest in a proper headset. What I will do for today is become creative and hold my microphone a little closer. So some of you are hearing me fine and others are not, correct? Much better. Okay, so I'm not going to pause the recording, but I'm going to pause my video and find a way to clip my microphone close to my head. One moment. Talk among yourselves, please. Okay, are you hearing me better now? And hopefully it's not too scratchity, a lot of static. Okay, great. So some of you went Westview. Is that the one at Bathurst and Shepherd? Or is Westview at Oakdale and Finch? Where's Westview again? Stephen Lewis and Vaughn. Yep, no Stephen Lewis. Markville Secondary. I went to Langstaff Secondary School. Does anybody care? No? Any Richmond Hill people out there? Thornhill people? Nobody. Oh, well. Victoria, which one did you go to? Used to live there. Yay! Yeah, I lived in Thornhill for, oh my gosh, I can't even tell you how many years. Von Thornhill, whoop, whoop. Still live in Richmond Hill, whoop. Yeah, I'm in Newmarket now. But my My family's still in Thornhill. Okay, so my little fix it me. One moment, everybody. I'm going to fix this and then we're going to start the course, okay? Testing, testing. Last time. Are you hearing me clear now? Thank you, thank you, thank you. Gotcha. All right. Good to have you all here from wherever you are across the GTA or our international students. Welcome again to Seneca, and everybody hands together. Yay! For passing HAP 101 in first semester. You made it. Good for you. So, as you know, this is a continuation of that core. Well, yes, of that course, the second half, if you will, of anatomy and physiology. And thank you, Asia. And let's move on with the rest of the systems, okay? So before we jump in, let us um, take your questions. Number one, why are we on Zoom? We are on Zoom because Blackboard was costing Seneca a lot of money. So we're going to try Zoom, okay? If it's really terrible, it doesn't work, we can always switch back to Blackboard. I'm going to post the recordings for each lecture a day or so after we get after class, and I'll put an announcement as to where those will be located. We only have class on Thursdays, except for those weeks where we have extra classes or test review. So what I'm going to share with you now is that schedule, which I posted under course information. All right, let me know if you're seeing it. Zoom is not as user friendly as Blackboard, but we'll work with it. Are you seeing the schedule? All of it? There we go. Yes? Great. Thank you, Keisha. All right. Is it Keisha? Keisha? It should be Keisha, I'm thinking, with a Y. And then usual Keisha. Very unique spelling. Good. All right. So here we are, right? Today is the 14th. Very good. We have class next week, Thursday. And week 3, we have class on Thursday, but we also have an extra class on the Friday. And that will allow us to get ahead and prepare for test number 1 during week 4. And note that all your tests are on the Fridays or when we would have our second class. So please go through the schedule. And if there are any questions or errors, discrepancies, just send me an email, please. Any questions on this? Nope? Okay, excellent. Now, I hope Zoom will let me set up those extra classes without issue, but we'll figure it out. We'll figure it out. I also posted an introduction PowerPoint, just gives you an overview of the course. Everything is pretty similar to last semester, so should be no surprises there. I will get your case study outline to you shortly in a week or two, so you know what is to be included, but I did include the, what do you call that thing, rubric for the case study already in the course addendum, so please look it over. Begin to do your research if you like on any pandemic except COVID-19. And I hope I don't get a whole lot of SARS. Extra marks, quick wink, wink to anyone that can find a unique pandemic. This is interesting. I use my little brooch to put on my microphone and he's upside down, but hey, who's looking? What else do we have? What else do we have? All right, how about I take your questions? You can post in a chat or you can turn on your microphone. Nothing at all? Okay. Have we finally accessed all of the course material for week 1? And hopefully the other documents are also available. So that wasn't me. I just want to put that out there. That was Blackboard. Wonderful, wonderful. And thanks to those of you that did email me to let me know there was an issue. I don't mind that at all, as long as you're respectful and just keep me informed. Excellent. Well, if there's nothing else to discuss, I guess we're done for today, right? No, 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 no. How about a Kahoot? Anybody interested in playing a round of Kahoot? Yes, Asia says. Okay, yes, 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 yes. Oh, yes. All right, Nathan, thank you. Or Natan, I apologize, it's Natan. All right. So it looks like most of you are familiar with Kahoot. If not, let me quickly walk you through it. It is an online gaming um, site. You go to the website, which is, I'm going to type it in the chat. That's not my house, but thank you. That's a nice thing about Zoom, right? I can use other people's backgrounds. And now my microphone's on the wrong side. All right, here we go. So the website is kahoot.it. No, yes, that's your website. Great. I'm going to try to find my game. All right, so this quiz is just a quick I have an interesting thing to share with you. Let me share my screen. You're going to love this. You are going to love this because we had a similar issue last semester. Okay, so I just pulled up Kahoot, right? Can you see what it says in red? The little warning there? Whoops, wrong screen. Can you see what it says in red? I'll read it for you. Before you play, please note that this Kahoot was reported and our moderation team is reviewing it now. Oh my. You know what the issue is? Oh, you're not seeing it. There it is. Do you see what the issue is? It's on the reproductive system. So they're concerned that we're including content that may not be suitable for all audiences. All right, where is my chat? All right, so I'm gonna have to open up another window for you. Let me choose that, new share. All right, here's a game pin. 9356521. There's a game. Put that in the chat for you. Yes, let me turn on the volume. Go ahead, Brianna, ask your question. Liam, I work better with please. Thank you. Brianna, you can type it, you can turn on your mic.
Hi, Lorraine. I was just wondering, will we be doing the lesson at all today for the 4 lessons that you posted, or will we be working on those tomorrow?
Okay, so we don't have class tomorrow. Today is a class. We definitely will be working through it. We hope to get through lesson 1 and 2. We'll do our best. We'll see how it goes. Yes, but today is definitely class time, and this is our introduction to the class.
Thank you.
You're welcome. Don't go anywhere. Stay with us. All right, we have 26 players. I have 50 people in the class. Where is everybody? I'm not forcing you to play, of course, and this is not for marks, but it's a good way to engage with the content and for me to have an idea of how much you came prepared to class. We DPM. Andre, help me. What's DPM? You know I'm not all caught up with the lingo and the abbreviation. Oh, I know. They log in for whatever reason and they're not here. That's their problem. Because you know what? It's up to you how well you do in the course. We're providing the material, we're here teaching. It's up to you how much you engage with the content and participate. And if you talk to any of my friends that had me last semester, they'll tell you that you do well when you come to class having pre-read and pre-listened to the lectures, taken notes, look through some of the ancillary content I've posted, as well as come to every class. And you know that those not only those bonus questions, Asia, but those short answer questions and some of the multiple choice too, right? So if you agree with me, please type, come to class. Type as somebody if you agree. That's it. Thank you, Asia. And it's always nice to have you and others. That's right. And engage in the chat. Remember, I'm not seeing you. I don't know you. I don't really know where you live. So it's low risk. If you type something and it's incorrect, we'll work with it. Incorrect answers are very useful because they help us to clarify understanding and sometimes lead to great discussion. So come to class, participate in class. Thank you for the 5 people that typed that in the chat. Thank you, Christabel. It's very important. All right, let's start the game. So if you're not familiar with this, you're on the website, you entered a game name after you put in the pin, and now you are going to use the shapes and the colors to select the answers for each question. Before we start, is everyone seeing the Kahoot screen itself with the game pin at the top? Yes? Okay. And while you're, hi Venus, and while you're answering me, you're probably also getting this alert on your phone. Yep. My goodness. It did, I mean, this whole lockdown business and the fact that they're going to charge you if they have a mind. But we got to stay home and stay safe, right? All right, let's do class. Here we go. Male reproductive anatomy. I'll give you a little hint here. This is anterior. This is posterior. Hopefully that helps. Do you recognize anything? All right, sorry, that went pretty fast. That wasn't me setting that up. I borrowed somebody's quiz. But that structure was the glans penis. So that's the enlarged distal tip of the penis. And yes, we will be using correct terminology to describe these anatomical regions. So we're going to say penis. Everyone say penis. They're waiting for you to say penis. Type it. It's okay. This is a safe space. Good. Good for you, Kat. Yes. And oh, one thing Zoom doesn't have is emojis. So Andre and Asia, anybody that wants to help me out with the emojis, especially if you have an Apple computer, what do you call those things? Mac? Yes, if you have a Mac, yeah, Christina, no more cookies. I will verbally give you cookies or someone can help me with their Mac cookies. All right, apparently you can copy and paste emojis onto pie. There's a song called Enormous. Okay, Andre, how long were you saving that up? Were you waiting for that all holiday? Okay, let's see. What else do we have here? Okay, what lies behind the penis? Oh my goodness, what lies behind the penis? What's this region here? Scrotum. Thank you, Aussie and Bold. All right, and housed within the scrotum natan are the testes. Very good. What other organ is housed and is an extension of the testicles within the scrotum? Long word. It's a word that will make you happy if you say it. Starts with an E. What's the structure that lies superior and posterior to the testes? That's the epididymis. That's it, Christina. Let's check the spelling. 1 Y, 3 I's, I think. Yes, there you go. Excellent. Okay. And what's this long two? Oh, listen, let's go on with the quiz. I'm going to give away all the answers. But you have an idea of what you're looking at now, hopefully? Yes? Okay, let's move forward. Oh, look what's there. Yay, you're paying attention. That's the penis. Are you telling me I have a whole 17 people in class right now? Tisk, tisk. What do you think? Should I not post the lectures? Should I not record them and not post them and maybe people will come to class? What do you think about that? Hmm? Don't worry, Evelyn. Just be a little faster. Liam is like, post them, please. Victoria's like, record. Okay, so Liam and Victoria and Asia, you still plan to come to class? Yes? Promise, promise? Yes. Okay. Well, the recorded lectures and the narrated PowerPoints, those I'll always provide. I'm talking about these class sessions. Oh, sorry, Nathan. Log back in, okay? The pin is still there. 935-6521. All right. Thank you, Katya. That's it. Let's do class. I agree with you. Number 3. Which structure are we looking at next? Beautiful. Well done, class. Woohoo! That is the urethra. Now, the urethra is a long tube, that passageway, that duct that extends from the base of this organ. What's this here? What am I circling? That's urinary bladder. Great. So the urethra begins at the base of the. Andre, you remember that? Okay, so let me clarify the hot mess joke. Wow, Andre, your memory. Okay, so that's the urethra. It begins at the base of the bladder. So it obviously, maybe not, but I'll tell you, transports urine from the bladder to the exterior for urination. The distal tip of the urethra is called the external urethral orifice. Okay, that's the end. Now, why is it highlighted here? Because as you notice, it passes through the penis, and the penis is a secondary reproductive structure. But the urethra is also a passageway for which other fluid? Please type that in the chat. Which other fluid passes through the urethra? The fluid is called semen, yes, and it contains sperm. So semen is a combination of the secretions from the 3 glands in the male reproductive system, plus semen and plus sperm and the fluid secreted with it from the testes. All right. So here's a hot mess joke. If the urethra is a passageway for urine and sperm, when a male is ejaculating, that's releasing the semen, what happens to his urinary function? Does a male urinate? Can he urinate while he's ejaculating? Okay, Patricia, glad you said that. Victoria said, nope, 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 nope. It's blocked off by PS. Ooh, Asia, did you read ahead? Or is it SNS? Good, good, good. All right, let's talk about it. When a male is having an erection, he is in the PSNS phase, okay? But ejaculation, which is the release of semen, is under SNS control. And Asia, did we not have a conversation about capital letters and proper nomenclature? Thank you very much. All right, under SNS control. SNS signals to the bladder, close off the opening. The internal urethral sphincter is shut off just prior to ejaculation. Phew! That way, urine stays in the bladder and the secretions that make up semen are allowed to be dispelled. And that way, urine is not mixing with semen, because that, Andre, would be a hot mess. Yes, it would. Yes, it would. All right. Good point. Can anyone name the 3 glands that contribute to semen volume? The seminal vesicles, correct? Ooh, I love this. Asia's ahead. She's prepared. This is awesome. Anybody else? Katya's, all right. The prostate gland, very nice. Natan, you're correct. Say it with confidence. Prostate. Come on, say it. Prostate. Now, androgens, Patricia, are hormones. We need glands. Good. Christabel said the bulbourethral gland. Excellent. And who knows the other name for the bulbourethral glands? The Cowpers. Well done. Yay. Okay, help me out, people. Where are the cookies? Where are the candy apples? Where's the pizza? Let's get some emojis up there. Christabel, you prefer Sandra? Is that what you're telling me? That's a cookie. All right. And pizza. Thank you, Liam. We also are finding out who has the Mac computers today, right? All right. Back to my friend who said, please, this is Sandra. What were you trying to inform me of? Do you prefer to go by Sandra? Yes, no? Can we get coffee? Thank you, Evelyn. She was right on top of it. That might be coffee. Whatever it is, thank you very much, Evelyn. All right, let's move on. Good job, everybody. Someone is using their daughter's computer. So today it's not Christabel, it's actually Sandra in class. Thanks. But I had a Christabel. Oh my goodness, I'm so confused. We'll talk offline, shall we? Okay, coffee. Yay! Vicky, nice. Here we go. What part is highlighted in yellow? Ooh, let's see who's paying attention. Excellent. Oh, look at my class. Look at my class. I need a mic drop or something. That was awesome. Cookies for everybody. Very nice. Very nice. Beautiful. So you're paying attention. Now, in the male, it's very easy to identify the urinary bladder. As you will see in the female, not so easy because there's another organ in the same area. These organs are actually anatomically adjacent to each other and they look almost the same. They're both muscular sacs. Which two organs in the female look alike in the pelvic region? The uterus and the bladder. Very nice catch. A cookie for you. Now, which one is superior? Is it the uterus or the bladder? Because that can get confusing too. Which one is the more superior one? I got two answers. We got bladder, 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 uterus, bladder, 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 bladder. Okay, if you are a mother, if you've ever carried a child, you will know, my friends, that your uterus sits on top of the urinary bladder. Oh, yes, it does. It pushes on the bladder. Oh my gosh. Listen, I have three, okay? And the youngest one is 13. And I'm having flashbacks right now. The uterus suppresses, well, it's not suppressing it, but it presses down on it. You will, listen, y'all just got to get pregnant once and you will never forget that the uterus sits on top of the bladder, okay? Christina, that's hilarious. That's hilarious. Did you know there was a potty or a toilet emoji? Why did Evelyn call Natan's name? Oh my gosh, I don't know what that's about. Excellent. Yeah, Nat and go get pregnant. I'm assuming that's a male. I don't know. Oh, wait. But I have a story for you. Did you hear about the male who jokingly took, let me turn off the Kahoot for a second. All right. There was a male who, as a joke, took his girlfriend's pregnancy test. And guess what? He was positive. Did I tell you this story? Oh, I told you already. Christina, you couldn't let me break it down, man. You couldn't let me just build up a little suspense. Yes, this gentleman tested positive for which hormone? Since y'all know so much, which hormone from his cancerous testicles indicated that he was pregnant? Oh, it wasn't LH, it wasn't FSH, it was HCG. HCG. That human, you're almost there, Asia. What does it stand for? Who can type it out? Human chorionic, very nice. Gonadotropin, excellent. Now, just looking at the name, it's very informative. It's produced by the chorion structure from the developing embryo, but it has a gonadotropic effect in that, what do I mean by that? It has a gonadotropic effect. What do we mean? What does this hormone do? It affects the gonads. Thank you very much. So in the female, this hormone is only produced when there is an implanted embryo. and it feeds back via the blood to the ovaries to do what? Let's see who's way ahead into lesson 4 now. I will personally give you old school happy face if you can remember, if you know the answer to that one. What's it protecting? Protects is a word. I maybe I'd use another word, but let's see what you mean by protect, Asia. That's a good word. It maintains the hormone producing structure within the ovary called the corpus luteum. Oh, that was so nice. Thank you, Asia. Now, it's protecting it or rescuing it or maintaining it so it doesn't degenerate, which is the normal um, experience of the corpus luteum when a female goes through her monthly reproductive cycle. The corpus luteum usually degenerates, and each month the female produces a new corpus luteum and a new batch of hormones. Okay, now, Natan just threw up the word shed. Oh, Natan, help me. What do you mean by shed? Who's shedding? What's being shed? What is not being shed? No, the corpus luteum persists, is the word I would use. It stays, it continues to produce its hormones. Okay, Christina, good question. So let me answer your question. Christina's asking, would atresia and degenerate mean the same thing, or do they mean slightly different things? Uh, atresia is a form of degeneration. It's cellular degeneration with a decrease in the number of cells. In this case, the primary oocytes. So in that context, you could use them interchangeably. They're synonymous that way. Okay, so the corpus luteum does not degenerate during the pregnancy. Good. Okay, we're almost there, B. B. Is it B? I'm going to say B. You can correct me if I'm wrong. All right. During pregnancy, the corpus luteum stays. It continues to produce two main hormones. Two main hormones? What are they? And I'm going to pull up the PowerPoint, and I don't want Kahoot to exit, so let's finish this off real quick. All right. So I'll skip the PowerPoint for now. Estrogen and its partner in crime, well, partner in pregnancy, hello, progesterone. Excellent. Now, high levels of progesterone and estrogen interrupt two things that normally happen to the female during her reproductive cycle. What does not happen during pregnancy? Menstrual cycle. Very nice. So someone says B, that the stratum functionalis is usually shed. That's the menstrual flow. That's the inner lining of the uterus. But because progesterone and estrogen levels remain high, due to the corpus luteum being rescued by HCG, menstruation does not occur. Good. I'm writing this down because I want to remember what we covered, okay? So menstruation does not occur because it's low levels of estrogen and progesterone that occur towards the end of the monthly cycle that usually lead to the shed that begins the next cycle. Excellent. We're going to discuss this again, so I'm just hitting the key points right now. Now, why is it important that the endometrium stays? Why don't we want the endometrium to be shed or sloughed off during pregnancy? Okay, protect the baby from what? From being sloughed off? That's right. The embryo would be sloughed away because the embryo is attached to and embedded in that endometrial lining. Okay, so you need the stratum functionalis to be maintained in order for implantation and development to occur. That would be a miscarriage. End of story. Gotcha. Very nice. Good. Okay, so you need high levels of estrogen and progesterone to maintain the stratum functionalis so that the embryo can remain attached. Excellent. Number two, what else cannot happen to a female while she's pregnant? Because of the high levels of estrogen and progesterone from the corpus luteum and later from the placenta. So miscarriage occurs when the woman doesn't have enough estrogen and progesterone. Asia, that is one of several reasons for a miscarriage. And I'm glad you're using your noggin. You are thinking, you're applying the information. I love it. Somebody give her a cookie. You're thinking now. So this might lead to a miscarriage. Yes. insufficient levels of estrogen and progesterone. Good. And there's several other reasons. Very nice. Well, not nice. Okay, Christina says the other thing that doesn't happen during pregnancy is ovulation. Somebody give Christina a cookie. Hello, Mac people, what are you doing? Help me. I don't see any cookies, no coffee, no pizza, nothing. There we go. Thank you, Victoria. So, why does a female not ovulate during pregnancy? You guys are way ahead into lesson 4, but I love it. And now, aren't you sorry that you didn't read ahead? Ah, Natan. But how is the embryo letting the body know that it's already there? It's the high levels of estrogen and progesterone, right? Okay. You wouldn't want another baby because this room is already occupied. Very nice. Okay. It's a negative feedback loop. All right. Thank you, Natan. Now we're getting somewhere. The high levels of estrogen and progesterone feedback to do what? I feel excited. I feel like we're moving somewhere here. High levels of estrogen and progesterone feedback to do what? Oh, finally, my brilliant CC class has nothing to say. All right. I uh, I don't want Kahoot to time us out, so that's why I'm not pulling up the slides. So I'm just going to describe it now, and then I'll show it to you later. It feeds back to the brain to suppress GnRH and more importantly FSH and LH. With low levels of FSH in particular, the follicles of the ovaries will not be stimulated to mature. Therefore, there will be no ovulation. So a female does not ovulate and cannot be pregnant while pregnant. And you know what, y'all? I'll just tell you since you're here, don't tell anybody else. You all just delved in to a bunch of short answer questions, okay? Being able to explain those phenomena. Excellent job. All right, let's go back to Kahoot before it kicks us out. Yes, Andre. But you're not stressed, right, Andre? Hopefully you're still in. Oh, yes, the Cowper's glands. Okay, remember we talked about those? The bulbourethral glands are also known as the Cowper's glands. These are located inferior to this organ. What's this one here? This walnut-sized organ. Okay, one moment. I lost my chat. Where's my chat? There it is. Great. The prostate. Thank you so much. Thank you very much. That is the prostate. Yes. And they contribute a small volume to the semen, but their contents, again, are required for protecting and maturing the sperm, as well as lubricating the penis during intercourse. Okay. Whoops, what did I just do? Good. Moving on. Well, they gave you lots of time for this one. The epididymis, yay! Oh, okay. We just identified this organ inferior to the bladder as a prostate. So way down here in the scrotum, oh my goodness. You know, it's kind of funny when you think about it to have a prostate down in the scrotum, right? That's not the prostate, that's the epididymis. So the three reproductive structures located in the scrotum are the testes, one is a testicle or testis, the epididymis. Okay, so each half of the scrotum has a testis and an epididymis. And then what's this long tube that extends from the epididymis into the pelvic region? That's the vas deferens or the ductus deferens. Both are correct, equally correct. Very nice. prostate out here. No, sir. Now, a good way to remember where the prostate is to consider a condition that's very common among middle-aged BPH, common among middle-aged men, starts at around age 35, 40, something to look forward to, guys. An enlarged prostate called benign prostatic hyperplasia. Let me type that in the chat. Write this down in your notes. BPH, benign prostatic hyperplasia, sometimes called hypertrophy, BPH. Okay, what does it mean? What does the benign mean? I wrote this to Nathan. I meant to write it to everybody. One moment. I'm loving Zoom. Good. Anybody familiar with that condition? Not that you have it, but someone you know might have it. Good. Benign means it's non-cancerous. Very nice. The hyperplasia refers to what? Come on, first semester, week 1, we talked about growth. Growth through what, Liam? Increased cell size or increased cell number? Hyperplasia is a type of growth. Cell division. Good. So there's an increase in cell number. Now, it causes an overall enlargement of the gland. So sometimes it is referred to as benign prostatic hypertrophy. That is not incorrect because hypertrophy is a very general term. But in this case, the growth of the organ is due to increased number of cells. It is non-cancerous, but it does lead to potential narrowing of the urethral passageway because the prostate surrounds the urethra, and that can strangle it and limit urine outflow from the bladder. So men who have BPH are at high risk for which condition? UTIs. UTIs is correct because the main risk factor for UTIs is urine stasis. Okay, let me type that. Urine stasis, or the stagnant non-flow of urine, not your in stasis. Urine stasis. Okay, urine stasis. I've seen some interesting things typed on tests. I just got to clarify. Let's finish up this quiz. We'll be here all day with the male parts. Back to Kahoot. Great, paying attention. That is the prostate gland. What do we have here highlighted? That's the vas deferens. Excellent. So what's the main function of the vas deferens? You know what? I just realized my grammar is all wrong. I have to retype my message. Not your in stasis. I don't like when people use the wrong your. That's what I should have typed. Okay. Anyways, back to the vas deferens. It transports sperm from what? From where to where? Pushes semen into urethra. Okay. It uses, let's say, smooth muscle contractions, yes, to help convey, I love that word, sperm from the testes and epididymis into the urethra. Excellent answer. Let's see if I can pull up that diagram after the next question. We'll elaborate on that further. Good, good, good. It passes through the inguinal canal. Thank you, Brianna. That is absolutely correct. Ooh, quickly, quickly. Good. Those are the seminal vesicles located on the posterior aspect of the bladder. Okay, so let's put it all together. So sperm are produced in the testes. They are temporarily stored, matured, or broken down in the epididymis. Please note the three functions of the epididymis. Sperm are also temporarily stored in the vas deferens, but the main role of the vas deferens is to transport the sperm from the scrotum up into the urethra. Correct. I love that answer. Now, the duct for the seminal vesicles joins with the widened region of the vas deferens called the ampulla to form this duct. What's this duct here? It introduces or conveys, lovely word, fluid from the seminal glands as well as sperm into the urethra. What's this short duct here? Excellent, Brianna. Brianna gets a cookie. That is the ejaculatory duct. Excellent. So the ejaculatory duct, thank you, Patricia, is a convergence of the seminal vesicle duct and the vas deferens. Good. Now, the seminal vesicles, approximately how much of the semen is produced by the seminal vesicles? That's so nice of you, Brianna. I love manners. Manners mean a lot to me. Good, Asia, well done. 60%. Good. Can you name three main components of the seminal fluid? What's important in seminal fluid? I mentioned about five things. It has fructose, okay, which is a sugar, very nice. Not glucose, fructose. Good. It is also alkaline, very important. And 60% fructose, alkaline, flagellum. It's viscous, yes. Not sure about the flagellum. The flagellum is only found on the sperm. It has another, it's viscous and it gets even more viscous. It actually coagulates. Remember, after ejaculation, something in this from the seminal fluid causes coagulation of the semen. Those are the clotting proteins, like fibrinogen, believe it or not. Okay, now let's talk about each of those. So, what's the purpose of the fructose? Please keep it clean. What's the purpose of the fructose? Anatomically, physiologically speaking, it supplies energy to who? The male? It allows who to make ATP? Which cells need that ATP? The sperm. That's right. So they produce ATP to power the action of the flagellum. Oh, I think that's what you were mentioning, Natan. So the ATP made by the mitochondria from, hello, the fructose, power the flagellum of the sperm so that it can transverse through the female reproductive tract. Very nice. Good. What's the significance of the alkalinity? All right. So remember I talked about avoiding pronouns because when you say it, I don't know who it is. Who's it? So the penis doesn't die in the vagina? All right. It allows the sperm to survive in the vagina. Very nice. It neutralizes the acidity of the vagina. Very nice. It counteracts the acidity or the pH in the vagina. But not only in the vagina, before the sperm have to make it to the vagina, they have to survive what? Ah, y'all just jump to the end, right? Just go right to ejaculation in the vagina. That's where everybody's head is. But before there, white blood cells, not the alkalinity so much. Before sperm gets into the vagina, it first had to pass through what? Hint, the urethra of the male. Thank you, Christina. That's right. It had to pass the urethra of the male, which is also very acidic. What makes the urethra acidic, everybody? Oh, Victoria, you answered before I spoke it. Hallelujah. All right, that's awesome. That is exactly it. The urine that also passes through the urethra makes the passageway very acidic. So the alkalinity of semen, most of it contributed by the seminal vesicles, helps to neutralize that passageway and protect the sperm. Everyone good? All right. So when you go to give me your short answers, I know you're going to elaborate. You're going to use proper pronouns. You're going to avoid its and theys. And you're going to speak specifically to what is involved. Last question for our quiz. Oh, I forgot the other gland, but we'll pick it up last. They really give you 30 seconds to answer this question? Okay. Yay! Almost 100% accuracy. Very nice. Now, the testicle is housed within the scrotum. So this entire skin sac is a scrotum. It houses the testicles, the epididymis. What's the plural of epididymis? Is it epididymises? I think it is. Or is it epididymi? That's an interesting question. Anyhow, and the proximal region of the vas deferens. Thank you, Brianna. Is this your first time in one of my classes, Brianna? Because somebody should have warned you. Somebody should have warned you. Wonderful. I'm glad to have you. Okay, now let's finish up with this diagram. We mentioned the contribution of the seminal vesicles. What's unique about the secretion from the prostate gland? Give me some information. I want, give me 3 features of the prostatic secretion. How would you study? How would you summarize this? Prostate gland, located inferior to the urinary bladder, surrounds the urethra. The fluid from the prostate is 25% of the semen. Nice. It provides sperm motility and viability by contributing what? Citric acid, which acts as a nutrient. Yes, to also make ATP to power the flagellum of the sperm. Nice. So what's the pH of the fluid from the prostate gland? Is it also alkaline? It's not basic. It's not. It's actually not alkaline because it has citric acid. It's actually acidic. It is actually acidic. But semen overall is alkaline because most of the semen volume is the alkaline secretion from the seminal fluid. Oh, below 7 would kill most people? No, I don't know what it is actually. To be honest, Aussie, I don't know what the pH is. It's just acidic. Now remember, hello, physiological acidity is anything below what? In your body, what is acidic? Anything below? Oh, Nathan, you just killed us. You killed off everybody's sperm, everybody's oocytes. The urethra's on fire. Anything have a pH of 3.75 is on fire. 7.35 is the answer. Thank you, Simran. Good to have you. All right, 7.35. So remember that physiological neutral is 7.4. All right, so a normal range is 7.35 up to 7.45. Anything lower than 7.35 is acidic. Anything above 7.45 is alkaline. Now, my friend Nathan, I don't think you meant to write 3.75. Maybe 7.35. Yes, I know that wasn't her. That's okay. You're typing quickly. And I understand everybody. You're typing fast. You want to get the answer out. So this is a space for errors. No harm, no foul. Just be careful when it comes to test time. Oh, I got rid of the diagram. So I'm going to have to pull it up during our PowerPoint. So get ready for those, please. But let's see who did well on this round of Kahoot. And don't take anything away from this other than bragging rights, right? Because some people have slower devices or they chose the wrong color, whatever. All right, way to go. C and Sam, nice. Okay, so let's stop sharing that screen. All right, how about we take a 2-minute break? Let's resume class at 10:48 or so. And we will start with week 1, lesson 1, and we'll just highlight anything interesting from that lesson, hopefully get to lesson 2. But we've already covered quite a bit of material. All right, see you in 2 minutes. All right, everyone, are we ready to resume? Resume. Oh, there are shortcuts. Haha. Andre, post your, no, I don't know if I'm allowed to say that. How can we do this in a secure way? Someone who knows someone, please start sending around the link for said chat. And I have nothing to do with it, but that's the best way to do it and keep everyone's information confidential, okay? Let's go, week 1. All right, so hopefully you've already learned a little bit about the sexual organs and function of the reproductive system. So the purpose of the reproductive system is not to keep you alive. It's one of the few systems that you do not need to use throughout your lifetime. You can actually survive, not optimal health, but you can survive without the reproductive system. However, the reproductive system is necessary for the propagation of the species. So if the human race is going to stay alive, we need reproduction. Now, it involves the uniting of genetic information from a male and a female. Thank you, Evelyn. And yes, uniting of the genetic information from a male and a female to create the full complement of genes on chromosomes to code for life. All right. Now, the gonads are the organs of the reproductive system, the primary organs, and these produce two things. What do the gonads produce in both the male and the female? Gametes and sex hormones. Perfect, Venus. Beautiful. So in the female, okay, thank you, Evelyn. Everybody, there it is. In the female, what are the gonads? Ovaries. Excellent. Uh, and in the male, the gonads are the testes. Good. And in the females, the gametes are the. Oh, look at you. Oh, you guys listening to me. You were listening to my little ray, my little thing about the egg. Thank you so much. I'm so proud of you. Man, don't tell Dee Dee, but you guys are kind of like, what? All right. There's always a rivalry between my sections. Beautiful job. So females release their gametes in their immature, incomplete form. They're called secondary oocytes. Good. Um, they're, the term egg is very general and a little misleading, so I don't like to use it. So we're going to call them oocytes. Excellent. Now, male gametes are called what? Sperm. And what's the fancy name for sperm? It matches oocyte. In the male, that would be a spermatocyte. Well done, Venus. Give yourself a cookie. Now, the process that unites these two gametic cells is fertilization. But note that fertilization is a multi-step process. I'm going to go over it again in week 2, but everyone take out a pen or pencil. So it's very interesting. My daughter um, found a website that plays episodes of a sitcom from the 80s called A Different World. Have you heard of this show? It's a different world. Have you heard of that? Yes, and I'm enjoying it thoroughly. And I'm actually enjoying it a little too much because it's creating flashbacks to my teenage years. Yes, ladies and gentlemen, I was a teenager in the 80s. Okay, now I noticed that on A Different World, when the students are studying and writing their papers, they're using pencil. Pencil, not even pen, pencil, which is very odd. I use a pen, I still write on paper, but you all hardly use pens and paper anymore. What do you guys capture your thoughts with? An iPad or a keyboard, a laptop, some electronic device. And some of you type faster than you write. Isn't that something? Oh, you write still, Andre? It works for me because it solidifies it in my head. I can type pretty fast because also back in the 80s, we used to have typing class in school. You write too, Hina? Good for you. Good, good, good. So studies will show you that handwriting or printing Use an Apple Pencil. All right now. Or don't even touch pens now. Good for you. But if you can use an Apple Pencil, that's actually better than typing it out. Typing is great, but your brain makes better connections with the content if you actually write it out. Just something to think about. Anyways, I don't know why I said that. Oh, yes, because I said pull out a pen. So pull out a pen or open a tab or a new document. Here we go on your computer. 3 steps of fertilization. Number one, let me maybe write it. Oh, you know what? I'm going to do it for you because you're such a great class. Let's do this. Number one, in order for fertilization to occur, first, sperm must meet germ. No, sperm must meet secondary oocyte. I can type. There you go. So the secondary oocyte is released from the female ovaries, protected by several layers of cells and a rich glycoprotein. Those layers have to be broken through, and the sperm must contact the membrane of the oocyte in order to initiate fertilization. That's the first step. After the membrane is contacted, this will then trigger completion of the second cell division in the oocyte in order to form the true gamete. The true female gamete is called the ovum. What is that last cell cycle called? That last step of cell division? Meiosis II. Very nice, Asia. So completion of meiosis II by the secondary oocyte to form the, okay, now is the ovum haploid or diploid? And what do I mean by such? The ovum is what? Haploid, right, which is denoted by the letter N. What does haploid mean? Tiffany, thank you for throwing in. All right, Tiffany, are you a genetic fan? You love your genetics? Half the number of chromosomes. Very nice, Venus. Very good. Excellent. Good. Now, what's the final step? We have half the number of chromosomes in the ovum. The sperm came already with half the number of chromosomes. What's the final step of fertilization? Not gestation. Before we have gestation, well, this is part of gestation. Before, hopefully nothing is inserting in the fallopian tube. But Natan, I want you to remember that and stick a pin because we're going to come back right after this and discuss that, okay? We have the 2 sets of chromosomes, but they're still isolated in their own nuclei. So the final step of fertilization is to unite the 2 pronuclei of the sperm and ovum to form the diploid, full complement of chromosomes, 2N. And what's the name of the first cell of the new baby? The new individual. It's called the zygote. Very nice. I wonder if that's why they call it a kid. Let me know if you get that joke. No, nobody? Nobody at all? Goat, kid? No? Thank you, Tiffany. Tiffany gets a cookie for laughing at my joke, even though they may not have found it funny. Okay. That's it. Now, Natan, this is just the first step of a pregnancy or gestation. Fertilization is 3 steps in of itself. I mean, you could break it down into further steps, but these are the 3 main steps. But fertilization is only the beginning of a pregnancy because in order to have a viable pregnancy, fertilization has to be followed by what? That's the word. Implantation. Pregnancy. Good. What is implantation? Can't just have a zygote bouncing around in the female reproductive tract. What does it have to do? That's okay, Christina. The zygote has to attach to the wall of the uterus. Okay, so it's no longer an ovum because it's fertilized now, so it's called a zygote. The zygote has to implant into the uterine wall. Natan, if implantation occurs outside of the uterus, do you know what that's called? Ooh, nice, Simran. That is an it's not an IVF. Oh my gosh. Okay, let's clarify. Let's clarify. Who got the right? Simran said it is called and then now I'm all tongue tied. Tongue tied. Twisted, twisted. Thank you, Lena, because or is it Linnea? Linnea. This Linnea, isn't it? Linnea? I think it's Linnea. Good. Uh, no. Oh, help me. Ek. There we go. Why can't I spell pregnancy? My keyboard is slower than my typing, so I'm not seeing what I'm typing. Linnea. Thank you, Linnea. Excellent. If the zygote attaches to the inner surface of the fallopian tube, that is a pregnancy, but it is an ectopic. Ectopic means outside of this normal location. Ectopic pregnancy. If the zygote implants in the pelvic cavity, if it implants in the, I don't think it ever would. Could it possibly implant in the vagina? I have not heard of that, but if you have evidence of such, please let me know. Okay, I'm looking for a diagram so that we can get perspective. Here's a female reproductive tract coming up, coming up. This is an anterior view. Oh, sorry, posterior view. I apologize, posterior view. So here we have the uterus or the womb. All right. The superior rounded part is called the fundus. The distal end that opens into the vagina is called the cervix. So this is where penis goes during intercourse to deliver the sperm. All right, we're going to get there, Aussie. What happens if it is ectopic? Now, let's go back. Where does fertilization usually occur? What's a healthy site of fertilization? Where should sperm meet secondary oocyte? Actually, in the fallopian or uterine tubes, also known as the oviducts. That is correct. So fertilization usually takes place up here, which brings us back to another issue. Sperm are deposited here, deposited in the vagina. That's where the bus lets them off. Okay. Sperm have to make their way through the two openings in the cervix, the external os and the internal os, and use their flagellum plus all that citric acid and what else was there? Fructose, and make their way through the uterine cavity. The walls of the uterus also contract to help move the sperm into the fallopian tube. Okay, there's a bus. Thank you. They travel far, Katya, far. And it's an arduous journey. And believe me, a lot of them don't make it. A lot of them die along the way. Okay, now, where is the secondary oocyte coming from? The ovary. Good. So the secondary oocyte is released from the surface of the ovary. It also needs to make its way into the fallopian tube, but it enters not from the uterine cavity, but from the distal end of the fallopian tube called the infundibulum. Let's all say that together. Come on. Close your eyes, put your middle finger to your thumb and go, infundibulum, infundibulum. That's a fun word, infundibulum. All right. Now, the fallopian tube is not attached to the ovary. So there is a possibility that an ovulated or released oocyte will not make it into the fallopian tube. If it doesn't make it into the fallopian tube, there's a good chance it will not be fertilized. What happens to that secondary oocyte? Is it going to hurt the lady? Is she going to be in pain? Who dies? The female dies? Oh my gosh, Natalia, we're in trouble because it happens a lot. Who dies? The oocyte. Oh, okay, thanks. It's the oocyte that dies. And that's natural. If it's not fertilized, it just degenerates. Just like sperm. If sperm are not ejaculated, it will not kill the male. The testes will not burst. The male will not suffer spermatic toxication. Okay. Like if sperm are not used, they just break down, they degenerate. Same thing with the secondary oocyte. Now, if the secondary oocyte makes it into the fallopian tube and meets up with a sperm and fertilization steps are successful, excellent. Now, that zygote is supposed to make its way now back down the uterine tube and implant into the uterus. All right, Aussie, I'll get to your question. If implantation takes place in a tube or out in the peritoneal cavity, that is ectopic. So back to a previous question, what happens if the pregnancy is ectopic? Anybody have an answer? Anybody? Let's see. Uh, Miscarriage is likely. A DNC would not be indicated here because a DNC is a scraping of the endometrial lining. Only if the pregnancy, if the implantation is in a normal place in the uterus. So a DNC is a dilation and curettage. Look that one up. DNC. Let me find the proper spelling. Dilation and curettage. Let me type it for you. I'm typing it in a chat. You guys are getting into some interesting topics here. Good. Dilation and curettage. Now, dilation and curettage is a procedure to remove tissue from the inside of the uterus. But we said that the pregnancy, the implantation, was in the fallopian tube or in the peritoneal cavity. Most often, ectopic pregnancies are in the fallopian tube. All right. So that is not the normal site of implantation. If it doesn't spontaneously miscarry, then the pregnancy may have to be terminated medically because that is unhealthy for the mother. What is the greatest risk associated with an ectopic pregnancy? Okay, listen. If you're going to say death as a complication or a risk for anything, yeah. But before death, bursting of the fallopian tubes and major hemorrhaging, that is a risk that can lead to death. Y'all gonna put death on a paper and expect me to give you a mark? Tell me how. Yes. Now, if it does survive ossia, often it will lead to a premature fetus. But listen, most ectopic pregnancies are unsuccessful. They can lead to future infertility because now it leads to scar tissue in the fallopian tubes, which will block the transport of the sperm and or the oocyte. Hemorrhaging is a major risk, Brianna, can lead to major bleeding if the fetus develops in the fallopian tube or the peritoneal cavity. Okay? Everyone good? So ectopic pregnancies are unhealthy for mother. They are not healthy for the infant either. Most of them will not be successful. Either they terminate, you notice I'm not using another word, they terminate spontaneously or they are medically induced for the sake of the mother. Any questions? Now, question, if a female has an ectopic pregnancy, will she have a positive pregnancy test? Yes. Why? Think back to what we said earlier. Because it's still implanted and it's still producing HCG. So HCG is a hormone. That's right. Yes, Nathan. And the HCG is still stimulating the corpus luteum in the ovaries. So it looks like a pregnancy. It is a pregnancy. It's just a implantation in the wrong spot. So HCG is a hormone that's tested for in the urine in your over-the-counter pregnancy test. It's also the hormone that's tested for in the blood as an indicator of pregnancy. Now, this is just me talking to you, woman to student, okay, mama to student. There are some things, my friends, that you do not buy at the dollar store. And one of them is a pregnancy test. I'm sorry. I am, the no frills commercial with the shop like a mother thing. That's me, right? I'm a no name brand, you know, holler, good. But there's some things I need the name brand for: dishwashing liquid, laundry soap, and pregnancy test. Just saying. Dollarama though. Think about it. This is a serious test. I don't know if I trust the one from Dollar Tree and Dollarama. All right. All right. So that was our little jump ahead into the female reproductive tract and system. I'm going to pull you back to week one. I love this way that I get stuck on slide number one in all of my sections. All right. So that was a good discussion on fertilization and la 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 la. What else we got there? Good. Pregnancy begins with fertilization. We talked about that. It's followed by implantation. Got that. And then we have the phases of development. Which weeks span the embryonic phase? Which weeks are the embryonic phase? During a pregnancy, during gestation, which weeks are embryonic development? Some things you just got to save your money for and do them right. Everybody, embryonic phase. Uh, Actually, technically, Christina, it encompasses fertilization to week 8. Yes. Day 0 to the end of week 8. Very nice. And the next, what's left? 42? The next 42? Technically 40. Not 42. The next 32. What phase is that? The entire pregnancy is called gestation. After embryonic, which is weeks 1 through 8, we then have weeks 9 through 40, which is the fetal phase. That's right. So we got fetal development, followed by birth, and the month following. Oh, you guys didn't know that yet. Maybe you do know. What is the month following birth called? Anybody? Thank you, Asia. Afterbirth. After postpartum is correct. Very nice. The afterbirth is actually what? Let's see if Christina or Lauren know. What's the afterbirth actually referring to? Delivery of the placenta. Say what? Okay, we'll talk about that in week 2. Let's not get too ahead of ourselves. Excellent. Let's move on to slide number 3. We did that. That's a new slide. All right. So we already met the testes. They're located in the scrotum. And we met the structures of the duct system. Let's look at them in our diagram. Slide 4. All right. So this diagram is very important. You'll see it on your test or something related to it. So in this diagram, of course, the orientation is different. This is now anterior. By now, you should be able to recognize a penis. I hope, everybody. And in the male that is not sexually stimulated, the penis lies flaccid or limp, anterior to the scrotum. All right, what else? Let's start in the scrotum. So the scrotum is the skin sac that extends from the pelvic floor, houses the pair of testes and the pair of Did anyone find me the plural for epididymis yet? No, I gotta do this myself. Plural for epididymis. I'm asking Google. Plural of epididymis.
According to Merriam-Webster, plural epididymides, MDes.
What? Epididymides? Are you kidding me? Epididymides. It's epididymides. I didn't know that. I would go epididymyses. Did you find epididymyses, Brianna? Organic chemistry. Epididymyses. I don't remember that from organic chem. It's a fun thing to say. Anyways, 2 epididymi. No, I keep mixing up. Epididymyses. No, epididymides. There we go. Epididymides. There we go. Epididymides. And the paired vas deferens. I can pluralize that one. Now, the vas deferens extends out of the scrotum and transports sperm into the urethra. The vas deferens, also labeled here the ductus deferens, extends through the inguinal canal, that's the passageway in the floor, and then wraps anterior to the pubic symphysis. Remember, that's the joint between the two pubic bones, lateral to the bladder, and then ends on its posterior aspect. The widening of the vas deferens is called the ampulla, where it joins with the duct from the seminal vesicles, and together they make this ejaculatory duct. So I hope you're seeing that. What can I insert here so you can see it? Ejaculatory duct. There. Okay, there's your ejaculatory duct. And the ejaculatory duct, again, empties into the urethra that begins at the base of the bladder and passes through the prostate. The prostate also secretes into urethra, as well as the Cowper's glands, and together the sperm, the fluid with the sperm, and the secretions from the seminal vesicles, prostate gland, and bulbourethral glands make up semen that passes through the length of the urethra. All right, what are the three parts of the urethra from proximal to distal, please? Epididymides. All right, three parts of the, yes, you're waiting for my question. Three parts of the urethra from proximal to distal, please. The three parts of the urethra in order. The prostatic, intermediate, and, prostatic urethra, membranous urethra, spongy urethra that ends at the external urethral orifice. Very good answer, Nathan. Prostatic, intermediate, and don't forget the spongy that runs, that's the longest part. That's the part that runs through the penis. All right, so the intermediate urethra is the part that runs through the pelvic floor. It is also called the membranous urethra. So that's why we had two answers there. So the intermediate urethra is also the membranous urethra. That's the shortest part. And that's where the Cowper's glands, the bulbourethral ones, contribute to the semen. The longest part of the urethra runs through the length of the penis. And that is the spongy urethra or the penile urethra. All right. And as Nathan mentioned, ends at the external urethral orifice. So this is the exit point for both semen and sperm, but we already established, thankfully, that those will not be happening at the same time. All right. What else we got in there? This diagram also shows us the structures within the penis. So the penis begins at the base of the pelvis as the root. The root includes the bulb of the penis and the two crura of the penis, which is better shown on a diagram from lesson 2. So let me pull that up really quickly. All right, so this is a posterior view of the male reproductive structures. So this is the urinary bladder from behind. We mentioned that the seminal vesicles lie on the posterior aspect of the bladder, and that the vas deferens wrap around the side and then the back. Do you see them there? Okay, and end in these widened areas called the ampulla. Together, the ampulla joins with the duct from the seminal vesicles, and here's our, look everybody, it's the ejaculatory duct that empties into the urethra that passes through the prostate. So the ejaculatory duct empties into the prostatic urethra. Nice. All right. Then the urethra passes through the pelvic or urogenital floor or the deep muscles of the perineum. That's your intermediate or membranous urethra. Those are the Cowper's glands. Bulbourethral glands secreting into that part of the urethra. and then the rest of your urethra runs through the length of the penis. Here are the parts of the penis that make up the root. We have the bulb, which is the intermediate, let me not call it intermediate, it's the more medial mass that surrounds the urethra. It is a proximal part of the corpus spongiosum of the penis, one of 3 columns of spongy tissue within the penis. It is partially surrounded by the 2 crura of the penis. Okay, one is a crus, stands for foot. And the crura of the penis are the proximal regions of the corpora cavernosa. So the 2 lateral and slightly ventral columns in the penis are the corpora cavernosa. So they begin at the root of the penis, and then let's go back to week 1. Extend through the length of the penis as the 3 spongy masses. Any questions? Are we good? Okay, so here we have the more ventral and larger corpus cavernosum if it's 1, corpora cavernosa if they are 2, and then the this corpus spongiosum is the one that surrounds the urethra. Also note that the corpus spongiosum enlarges distally. That forms the glands of the penis or the head of the penis. It's surrounded by skin called the prepuce. What's the other name for the prepuce? Prepuce, if you will. The foreskin. No, I got you, Katya. The foreskin. Very nice. Now, the foreskin and the glans penis itself are highly sensitive to tactile stimulation, if you know what I mean. Yes. So stimulation of the penis definitely leads to sexual arousal and can lead to an erection. And then we'll continue the rest of the story at the end of lesson 2. Which operation is done to remove the foreskin? Circumcision. Now, circumcision can be opted for religious purposes, for hygienic purposes, or just personal preference, family tradition, whatever it may be. I'm not going to get into the whole discussion on that, but that's what it is. Removal of the foreskin of the penis. But let me clarify. Females have analogous structures. Oh, I don't want to show it to you today. It might be too much. But females have spongy tissue covered by foreskin or the prepuce. And in some cultures, female circumcision is also practiced. In case you didn't know. Yes, but the foreskin of, what's the spongy tissue in the female called? What is the structure in the female that's analogous to the spongy tissue in the penis of the male? Some of you don't want to say it, but you have one. Not the labia minora anterior to it. Some people call it a mini penis. It's homologous to a penis. Anybody? It's the clitoris. Say it, girls. Clitoris. Yeah. Isn't that illegal? I don't know if it's illegal, but it is practiced in some cultures, as I mentioned. What is the purpose? It's not necessary to remove the pupus. There is no scientific evidence to support that it improves hygiene or decreases the rate of UTIs. But it does have receptors for sexual stimulation. So there's actually an argument to let it be. So that brings us to the next study, Brianna. Maybe you could lead this as your nursing research paper. Circumcised males versus non-circumcised males. Who enjoys themselves more? I don't know. Is there research done on that already? Somebody must have done that already. I'm sure I'm not the first one to ask that question. Interesting. Nobody's talking to me. I'm waiting for someone to join this conversation. Okay, good. Moving on. Something to think about, though, or research on your own. Did I answer everyone's question? Good. All right. I think that's enough enough from that diagram. Let me just make sure we caught all the major structures. Excellent. Moving on, because time is almost done for today. All right, so the scrotum is that skin sac, of course, extending from the pelvis, and it houses the paired testes and the epididymis and the vas deferens, or the epididymides. Sorry. Yes. Now, it's divided into a right and left half by a ridge of connective tissue. What's that ridge called internally? Anybody? The scrotal septum. Excellent. And on the outer surface, it's a distinguishable ridge here called the raphe. Okay. Now, what do I want to say about this diagram? You can see the vas deferens is bundled together with blood vessels and nerves to make up the spermatic cord. Remember that the testes must be highly vascularized in order to transport the testosterone produced there. All hormones travel in the blood. So you'll see that most endocrine glands are highly vascularized. In our narration, we mentioned the two connective tissue layers around the testes. The more superficial is the tunica vaginalis. The deeper one is the tunica albuginea. And the tunica albuginea extends internally into each testes to form the septa that define the lobules. What else we have? Oh my gosh, there's a lot of things I should have talked about today we didn't get to yet. We talk about the two muscles that help to regulate the temperature of the testes. What are the two muscles? The dartos and the cremaster. Good. Now, why must the temperature of the testes be regulated? First of all, who left the testes out? Yeah, I can't sing that today. I won't do that one. Who left them out there? Not so much about sperm death. It's about sperm production. That's right. Again, not so much about sperm death. It's about sperm production. What about the temperature, Victoria? Give me a nice second semester college level answer. The temperature of the testes, start with that. The temperature of the testes must be 1 to 2, actually 2 to 3 degrees lower, not room temperature, Nathan. That is a good wrong answer on a multiple choice question. I hope I remember it. They need to be lower than body temperature, core temperature. That's right. In order to maximize sperm production. Correct. Now, that then brings up the argument, gentlemen, Speedos or boxer shorts? Think about it. What type of brief works for you? Which one allows the temperature to be regulated better versus which one keeps the testes too close to the body? So Victoria's going to buy boxers for the men in her life. All right, there you go. I'm just joking on that, by the way. No, there might be research for that too. I'm giving you guys all kind of research ideas. You need to come back and pay me after you get money for your papers, okay? I need a cut. What else we have? A vasectomy. Let's talk about vasectomy quickly. What is a vasectomy? Vasectomy. A vasectomy is a surgical procedure that clips the vas deferens. Surgery so men can't produce sperm. Not quite, Evelyn. They still produce sperm, but it's very hard to reverse it. It cuts away parts of each vas deferens and seals off the cut ends. That is correct. And it's a form of male sterility. Now, it doesn't create sperm that are not viable. The sperm are very much viable. It's very similar to getting the tubes tied in a female. All right, let's talk about it quickly for time. A vasectomy, ectomy means to cut away. So a part of the vas deferens on either side of the scrotum is cut away. And then the cut ends are tied off or soldered off. Codded, I think is the word, okay? Now, how does that create male sterility? How does this lead to permanent, highly irreversible birth control in the male? Are the sperm affected? Is the production affected? That's it, Jacqueline. Give yourself a cookie. There's no tube. That's it, Natan. There is no tube to transfer the sperm. Well, the pathway has been disrupted. So sperm are produced down here in the testes. In order to father children, the sperm have to pass through the vas deferens and enter the urethra and exit through the penis. But if part of the vas deferens is cut away, sperm are produced, but they cannot enter the semen. So, questions. A male that has a vasectomy, can he still have an erection? Yes. Can he still have intercourse? Yes, I like the exclamation mark on that, Jacqueline. And will he still produce semen? Will he still ejaculate? Yes, but the ejaculate is void of sperm. That's it. He still makes semen, but the semen has no sperm. And that's how it creates sterility. Brilliant. And very easy. It's day surgery. Like, I could do this for $50 in my garage if anyone's interested. No, it's COVID time. You better stay home. There were shoot blanks. I like that, Brianna. That's a good one. There's shoot blanks. Now, another fact to consider is that the testes develop in the male pelvis during gestation. Okay, so the developing male fetus develops the testes up in the pelvic region or abdominal pelvic region, just like the female's ovaries develop. At about what age of gestation will the testes descend through the inguinal canal down into the scrotum? Not 7 weeks. You got the 7 right. He doesn't have testes at week 7. Or he has very small developing testes. 7 months is correct. 7 months, correct. Now, failure of the testes to descend into the scrotum is a condition called, I'm going to type it for you, cryptorchidism. Cryptorchidism. Say that one 3 times fast. Cryptorchidism. Cryptorchidism. It has a synonym that I will not try to pronounce right now. This is failure of the testes to descend into the scrotum or the absence of the testes from the scrotum. This carries 2 risks. What is the risk number 1? What could this lead to in the male? Good question, Asi. I'm coming back to your question. Oops, new sterility, correct. So because the testes remain in the abdominal pelvic cavity, the temperature is too high and that decreases sperm production. So that can lead to male sterility. The other risk is for testicular cancer. All right, so failure of the testes to descend increases the risk of the male developing testicular cancer. Now, Asya asks a very important question. If the male has a vasectomy and not sure what the risk is there, Natan, without getting into the biochemistry and the physiology of cancer development, but we'll just summarize it there for now. Hernia, it may, I'm not sure of the association with hernia. Inguinal hernia, so it may. So with the hernia, are you talking inguinal hernia through the umbilicus? Or actually that's called a, sorry, I correct myself. Inguinal hernia is where some of the tissue, I believe the intestine, protrude through the inguinal canal. It may, Brianna, I'm not sure. If you can find me some evidence, that would be great. Okay, I just want to answer up a few more questions. Cryptorchidism. I think I answered that question. Oh, the question was, what happens to the sperm that are produced in the testes but do not get transported into the semen for ejaculation? It's the same thing that happened to sperm in male who are not sexually active or have not had any activity for a while. Remember we said, if sperm are not ejaculated, what happens to them? They degenerate. That is correct, Natan. They just degenerate, okay? So again, it won't kill them and there's no toxicity. The components of the sperm cells just get broken down and used over again. Beautiful. Okay, how much time does Mrs. Christie have? A whole 4.5 minutes. Did I answer everybody's question? So, Brianna believes that another risk associated with cryptorchidism is hernia. I won't doubt it. I just don't remember seeing that specifically. Okay. So please go to the narrated PowerPoints. There's a lot of content there that I'm skipping over. Note the functions of the Sertoli cells within the seminiferous tubules of the testes, and that the Leydig cells are the ones that produce testosterone under the influence of which hormone from the brain? GnRH does not target the testes, but you're on the right pathway. GnRH first targets the anterior pituitary to release what? In this case, not FSH, we're talking about testosterone production. Which of the two hormones from the brain targets the testes to stimulate testosterone production? That would be not aldosterone. No, 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 not aldosterone. No, 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 no. What's who's FSH's partner? Luteinizing hormone. Thank you, Fiza. Yes, luteinizing hormone. So here's an easy way to remember it, everybody. This is easy. Luteinizing hormone stimulates the Leydig cells. They both start with L, leading to the production of testosterone. All right. FSH stimulates the Sertoli cells to produce androgen binding protein and to stimulate spermatogenesis. All right. So spermatogenesis involves the cell division of the spermatogenic cells. I'm really out of time. So we'll have to take it up here next class. And we're going to start, somebody can remind me, by comparing spermatogenesis to oogenesis. And we'll walk through them both side by side. And there will be like a 2-for-1 deal. We'll knock out both in one discussion. But thank you, everybody, for a wonderful class. Hope you learned something. I actually have 2 minutes. All right, so let's talk about it for another minute. But again, read ahead. We'll finish week 1 and start week 2 next class. We should be done. Hi, Patricia. New to Zoom. Me too. Is the recording going to be posted? It will be posted in a day or so, and I'll put up an announcement when it is. You're welcome. Let's finish off class. I'm done. I'm tired. That was too much fun, though. Thanks for the cookie, Christina. You're so sweet. If you didn't know, Lorraine likes cookies. Thank you. Thank you. Thank you. Nice to have you, Dina. Linnea, got it right. Dina, Simran, Andre, Vicky. Yay. Bye, Tiffany. Thank you. Thank you. Thank you. All right, Victoria and Jacqueline and Anoop and Natan. Thanks for all your contribution. Oh, slow down, everybody. Natan has a question. Hold on. You're welcome. You're welcome. You're welcome. Celestica. Anas? Ansa. Sorry. I hope I got it right. Or Anne. You didn't separate your last and first name, so I'm making it up. What was Nat's question? So, what would be ejaculated? Semen without sperm. Thank you for answering that question. Okay. A negative. Okay. Sorry, just going back in the chat. Inhibin. Inhibin is released to regulate the rate of sperm production. It's not that there's a limit to storing sperm. It's just under negative feedback control. You don't want to waste nutrients and energy, right? You make as much sperm as necessary for vitality, but you don't need extra. It's just negative feedback. Okay. Looking for Nat's question. It's coming. It's coming. Thank you, everybody. Are sperm cells still immature at this stage because they haven't mixed in with everything yet? Yes. Sperm morphologically are mature, so they have all the body parts. Oh yes, I feel a message coming on. They have all the parts that necessary for fertilization, but physiologically, biochemistry, they are not capable of fertilization actually until they're exposed to chemicals within the female reproductive tract. Hope that answers your question. Good. Just like young people, right? So by age 15, well, even younger than that, males have and females have all the parts and all the components necessary to make babies, but really, are they mature enough and ready to be making babies? I'll leave it at that. Thanks, everybody. Have a great day. People are still here. Any other questions? See you next week, Andre. All right. Nakiru, thank you. I'm sorry if I'm mispronouncing your names. Take care, everybody. Remember to hit leave. Leave the meeting. Go. Is there any way you can post the other documents that are posted under the YouTube videos? For week 1? Yes, I will share them in another announcement like I did for these, okay? They still don't open. Can you guys please harass Blackboard support and figure out what's going on? Thank you. But I will make a note and do that for you, Christina. Share other week 1 documents and links. I will do that. You're welcome. Jahinthan, thank you for joining today. See everybody next week, Thursday. All right. Take care.